Africa has just chosen a new leader who will help shape the continent's health. And his top priority, an ambitious one, is to ensure that no one on the continent has to sell their land just to see a doctor or to seek medical help and support. Meet Tanzania's Dr. Mohamed Janabi. On May 18, 2025, Professor Mohamed Janabi, a prominent cardiologist from Tanzania, was nominated as the next World Health Organization Regional Director for Africa. His nomination followed a special election by African health ministers and has since been officially confirmed by the World Health Organization Executive Board. But this comes after a tragedy. Last year, a respected Tanzanian, Dr. Faustin Ndungulile, who was also a former Deputy Minister of Health in Tanzania, was elected and nominated to this very position. But he died, sadly, before he could be confirmed and before he could start his tenure. And now, Dr. Mohamed Janabi steps in, bringing over 30 years of clinical and policy experience from the early days of the HIV crisis to founding Tanzania's top heart hospital. Dr. Janabi has a long list of accomplishments. Notably, he was one of the first clinicians in Tanzania to support HIV and AIDS vaccine trials in the early 2000s. I know him from when he persuaded a sitting president of the Republic of Tanzania to take an HIV test live on air. This had a positive ripple effect. In that year, over 5 million Tanzanians were able to get tested. Testing for HIV is a critical tool to allow proper treatment but also prevention of HIV. One of his most notable accomplishments is founding the Jakaya Kikwete Heart Institute, which has reduced the number of foreign referrals for patients in Tanzania needing heart surgery by 95% in just 5 years. Dr. Janabi has his work cut out for himself. On the African continent, as far as health is concerned, there's a lot of ground to cover. Here are just a few statistics. Dr. Janabi wants to fix that. He has 3 strategies: investing in community health workers, scaling up local vaccine production, and pushing for predictable health financing across the African continent. The most defining question that faces Dr. Janabi as he embarks on this tenure as the regional director of the World Health Organization Afro region is this one. Can the African continent define and build a healthcare system that works for everybody and not just the wealthy? Based on Dr. Janabi's track record, there is a lot of hope for the continent.